So hi everyone, welcome to this short, almost like a breakthrough session, entering into our last phase of our INISS prep. So we did 2 or 3 sessions heading into these entrance exam roadmap when we initially had an assessment that INISS would be before NEET SS. We thought NEET SS would be something around Jan, and then they released a sudden date, kind of a surprise, where they gave it as November 7th, 8th or so. And then we kind of planned that, okay, let's prepare for NEET SS first, and then we'll have that window to prepare for the specialty of INSS. But now there's no clue as to when the NEET SS will be held. And I'm getting news from the passing out batches of the SS batches across various colleges of the country, that most of their SS exit exams have been postponed into January. So usually what happens is when the outgoing batch starts going out, then the entry starts, right? So that's one other reason possibly that NEET SS has been delayed, and we expect it to be at least in 45 days after the announcement. So for example, now today it gets announced, it will at least be on December 1st. So it will be after INSS, that's for sure. And at least there'll be a 45 window gap, bare minimum. So firstly, definitely you have to prepare for INSS, and in a way it has been good that NEET SS, there was that confusion if there was NEET SS or not, because now we have, all the students have prepared the general part to a good extent, right? So general part, because general is what is asked in NEET SS, the general part is going on along with our Elite series, the mini tests. I hope you have been doing the general part to a good extent. So now last, what's 40 days, I think, around even less than 40 days now, just around 22nd is the exam. So it's around 5 weeks, I think that would be better said. So 5 weeks, I would suggest at least 90% of the time has to go into your specialty prep. So this was what we thought initially we thought NEET SS followed by NSS, but then it's disappeared. Now it's just the NSS that we have, and possibly later the NEET SS that will come. So the exam now is on the 22nd of November, that will be held in all these areas. And as I told you, coming into thinking about the preparation, definitely 90% of your time should go into specialty, because out of these 80 questions and 20 questions which will be there as an interview in some of the, in AIMS PGI, as it is said, 20% there'll be an additional interview. So all of these, almost from these 100 questions, only 20 questions will be your general pediatrics, and rest of the 80, that includes your 20 of your interview, as well as around something like 55 to even 60 questions of your theory. All of that will be your specialty. So when 80% is your 75, at least 75 to 80% is your specialty, and you have been reading general part to a good degree through your last few months, definitely this is the time to mainly focus on your specialty. I know there'll be some specialties which might not have the amount of content that deserves that 90% of the time, that but you can always increase your thoroughness, right? For example, if you look at something like a short subject like pediatric rheumatology per se, so there you might say that what will I do of so much time, while I have so much else to study in the other systems. But then if you see the cutoffs are also very high. That is, you just cannot do effort to do a silly mistake, right? So you have to be extremely thorough in your pediatric rheumatology. Try to get at least 95% of your questions correct there, and then the rest of it, obviously, you will have prepared for NEET SS through the last few weeks, and also you will be giving some time for the previous year questions through the next few days. That will take help you through the rest of the 20 general pediatrics questions. So coming to another, a little bit of a in-depth thinking about how to prepare for these. Now I would not suggest you to even look at Nelson. If you have some notes, if you have some very crisp notes, give around 1.5 to 2 hours to those notes. 1.5 hour is enough to those notes, and rest of the half an hour, definitely look at the previous year questions. Just the questions, don't jump into the topics, because once you see a question and try to do the previous year topic, that itself can take you 1 hour, right? So let alone the topic, just the question, just the answer, and understanding why the answer is like that. So just the previous year question you do. And usually I think the previous year question, if you do not have, you can go through our videos, or if you have, I think most of you might have the previous year questions from your seniors, etc. If you do have, definitely go through those previous year question only, no need of the topic. Apart from that, the 80 obviously it depends on your specialty, which I'll briefly cover, right? So understanding the merit list, firstly there will be a theory of your 80 marks followed by 20 marks interview, and these 20 marks will be accountable only for AIMS and PGI. That is, once you give the theory, there will be that 80 marks merit list that will be prepared, and that will be called common merit list. And for JIPMER, it will be this common merit list that will, that will be applied while going through the proceeding through the counselings. But after your interview, there will be, obviously both these lists will be released together only, but the list will be prepared before itself. The common merit list will be prepared before itself when the theory exam is done, and after the interview exam is done, the AIMS merit list will be prepared. Based on this AIMS merit list, not only AIMS but also PGI, so both AIMS and PGI will have this interview based, selection. We'll come to, after your theory exam, we'll do a session on the interview preparation also. So both AIMS and PGI will have this list called AIMS merit list, based on which your counseling will happen. So coming to each of the subjects, I'm not going in depth onto how to prepare in each specialty. We've done a session, I think around 3 months back, not even three, I think it's been 5 to 6 months back. Me and Aditya had come and done a session where we discussed at least like 3-4 minutes on each specialty, how to prepare each specialty. Obviously, none of us have given all the exams, and none of us have the experience of giving all the exams and knowing how to prepare for each exam. None of us have cracked every exam. So we also have certain videos on YouTube where I've talked to toppers from critical care, toppers from pediatric cardiology, genetics, and I think pediatric neurology. So if anyone is wanting a little bit more of an in-depth experience of how to prepare these INSs, they can definitely go to those podcasts which are available on our DocTutorials YouTube channel. So I'll just be telling you main books, what are the main, core materials which the toppers have prepared from, right? So neonatology, mainly the main core book is your AIMS NICU protocol, and over and above that, whatever topics are being repeated, those you'll have to read from Cloherty. And if not, if some topic may not be given well in Cloherty, then you can use Nelson itself. Then we come to pediatric hemato-oncology. Pediatric hemato-oncology, HAMAT, HOD herself, Dr. Amita ma'am herself says that Nelson is usually enough, and very much well written book as far as HAMAT is concerned. So Nelson is enough for your HAMAT, while your Lenzowski is your standard book for your oncology. This is what is enough. And there are certain case-based scenarios. There's a book called Case-Based Scenarios in Oncology, which has come out from AIMS Delhi. That also you can use if at all you have extra time. For leukemias and lymphomas, you can use that book if you have extra time, because it's written by the AIMS faculty themselves who make the paper. And yeah, there are two separate exams if somebody wants to have that hematology, bent of training as well. Then they would have to consider the PGI and the AIMS Bhopal course, which includes hematology, while the AIMS Delhi course specifically includes pediatric oncology only. The hemat, like platelet part and anemias part, that is usually taken care of by the adult medicine people in AIMS. Coming to pediatric nephrology, Dr. Arvind Bagga's book is the gold standard, because most of the questions are framed by that. Apart from that, there are also certain guidelines, ISPN guidelines. So each of them will have very latest guidelines or something that has changed. Yeah, so each of the subjects will have certain guidelines from where you'll have to read as well. So in case of nephrology, it will be the ISPN guidelines, which are the main standard guidelines. Then pediatric critical care, again, be careful as to what branch you're choosing, because every institute has a different branch. So if you uh, I think by mistake I've put in immunology here. So you have pediatric critical care from PGI, which is the usual PGI, and JIPMER has pediatric critical care, which includes your PICU and emergency medicine. While your pediatric emergency medicine is primarily emergency medicine, ICU training is little bit less in your AIMS Raipur, and in AIMS Delhi, AIMS Bhubaneswar, as well as AIMS Rishikesh, there is an inclusion of pediatric pulmonology. So in your PGI, pediatric pulmonology is a separate DM course in itself, while in your AIMS Delhi, Bhubaneswar and Rishikesh, this is included along with your intensive care. Like it's almost like a critical care plus pulmonology. So coming to the preparation part, again, AIMS PICU protocols. There is PGI PICU protocols as well, which is a very good summarized version, but AIMS PICU protocols, which is a little bit more bulky version, that should be your base. And over and above that, for your previous year topics, for the topics which you consider which are very important, there you can use your Rogers short handbook, not the bigger Rogers main book, which is the standard book that DM students study from. That, not that one. The shorter handbook of Rogers, that is the one that you can use in as an addendum to your AIMS PICU protocol book. Apart from that, there is also a Kamath and Gandhi handbook of pediatric ICU that is also used for these additional topics preparations. Pediatric neurology, Nelson is your basic standard textbook, which has the optimal amount which is asked in the exam, and also what you can remember, because it is a very volatile topic subject per se. So Nelson is usually what is considered sufficient. But if I know the competition in pediatric neurology is actually very, very tough, because 4 is very, very less number of seats for the number of students that give, and also the number of the type of students that give are very much interested in pediatric neurology from almost like the middle or their starting of their MD. So there you need to have an edge. So you can consider Swyman for your epilepsy and neuromuscular disorders. And also, if you can get hold, I don't think we have INSS previous year questions of neurology on our app. We don't have that. So if you can get hold of some previous year topics from some of your seniors, you can definitely get that, because old PYQs reading from something like Swyman, that helps a lot. Pediatric gastro, so this is another area where you have to focus a lot on guidelines. It's not just your Nelson you have to be thorough with. It's not very, very bulky as far as Nelson is concerned, but also you have to go through the NASBGAN and your SBGAN guidelines for various topics. Like there are various flow charts for your button battery ingestion for Wilson's, autoimmune hepatitis, eosinophilic esophagitis, your H. pylori gastritis. All of these have guidelines and flow charts as to how to manage these patients, and questions come directly from those flow charts. So that you should definitely remember. Especially, I'm not sure how many people are preparing for peds gastro. This is a good attempt. If somebody is interested in peds gastro, they can definitely go ahead. The question paper might be tough, but also the competition is not very, very high. And also this time, usually you rarely find two seats coming together. Usually it's May AIMS Rishikesh 1 and November PGI 1, right? So this time you have two seats, and it's a great opportunity if somebody is interested. Coming to PAIDS cardio, as I told you, we have a prolonged podcast with Dr. Swaminathan, who cracked AIM, who is now doing his pediatric cardiology in AIMS New Delhi, and he cracked rank 1 around 2 years back. So he has given us a detailed account on how he prepared, and obviously we have very few, we have a very small database as to who prepared like whom, like what, but he prepared Park's cardiology line to line, all the important topics from the first page to the last page of that topic. So he was completely Park's cardiology based preparation, but he also used Moose Adams for embryonic cardiology, pregnancy cardiology, so you can consider that as well. But yeah, main is your Park's cardiology according to him. Coming to genetics, there is this Emery's elements of medical genetics. We have a podcast with Dr. Abhinaya on our YouTube channel. You can go through that. So she used predominantly Emery's elements of medical genetics as well as Nelson for the main preparation. That is that. Coming to pediatric rheumatology, for the main rheumatology part, so as you know, there are around 50 questions, 50 to 55 questions that come from pediatric rheumatology in your 80. It's little less than other super specialties. Other super specialties have at least 55 to 60 questions. Here it's 50 to 55, out of which at least 30 to 35 are pure pediatric rheumatology questions that come from Nelson, while the rest of the 20-25 questions are your primary immunodeficiency, autoinflammatory syndromes. So these pediatric rheumatology questions, you don't need to go anywhere else apart from Nelson. Maybe a small question here and there that might come, that might go beyond Nelson, but this is what you should be absolutely thorough with. PID and autoinflammatory, almost everything also comes from Nelson only, but you can look at the STEAM's pediatric immunodeficiency tables. If it's possible, if you have time, I know pediatric rheumatology is somewhat of a smaller area compared to other branches. So if you have time, you can go through the tables that are there in STEAM's pediatric immunodeficiencies and autoinflammatory syndromes. If somebody needs this book, I can send them this book, PDF of the book, if somebody is preparing for pediatric rheumatology. Coming to pediatric endocrinology, the usually again Nelson is your main go-to book. Again, we have very few database. I just asked 3 to 4 people who have cracked pediatric endo, and most of them studied Nelson only. There is a book called Sterling's Pediatric Endocrinology. There is a IAP textbook on pediatric endocrinology, but questions are usually solvable using your Nelson only. If at all you have some additional information that you want, you can use your IAP textbook, which is usually considered standard in the rounds that are going on in your DM pediatric endocrinology circles. Right, so that was about INSS. I know I kind of didn't go through each particular branch and tell you. Aditya will be doing a session 2 weeks from now, so he will dwell upon a little bit more on how to prepare for each branch, and also he'll guide you on the guidelines, from which areas guidelines are coming from. And if suppose somebody who's preparing for a specific subspecialty, they can always get help with, from us, or ping us on our WhatsApp group, or directly DM us as well, as to what specific guidelines are to be studied for what subspecialty, right? So thank you. You can scan this QR code and join our WhatsApp group, where we keep discussing and clearing your doubts.